invested. And I think that it has potential to get back that way.
Are we good?
They kind of spread that out.
We're live? Okay.
Awesome. Good evening, everyone. I think we're going to get started because we've given ourselves a pretty aggressive timeline of exactly 1 hour. We have people joining us on Facebook who are going to be able to listen to these comments. We are also going to be taking photographs in the room. And so I just wanted to say that right at the beginning, in case that made anyone feel uncomfortable. This gives you the opportunity to leave if you don't want to be part of any photographs or the live stream. I also wanted to let you know that we have a QR code at the back of the room that as you're leaving, you will be able to use this to sign the petition asking Congress to not cut Medicaid. So with that, I'll get started. My name is April Holman. I'm the Executive Director of the Alliance for a Healthy Kansas. We are an organization that is centered around health policy advocacy and specifically wanting to make sure that there is access to affordable health care in Kansas. And we want to be able to reduce medical debt because more people are covered. So when we talk about the threat at the federal level today for Medicaid cuts, we're talking about one of the most significant threats to this program ever. The proposal that has been made in the U.S. House of Representatives is to cut $880 billion over the course of 10 years. That is a significant part of the Medicaid program, over 10% of its overall funding. We know that however those cuts are ultimately made, it is still going to impact people who will not be getting their health care anymore if they take this much money out of the system. So you will hear lots of buzzwords when policymakers talk about this. You might hear things like, well, it's just going to be work reporting requirements that are cut. We're not going to cut actual Medicaid. We're just going to cut the provider fees that are charged. But all of those things are ways to put less funding into Medicaid and use those dollars for something else. We need them to know that we understand that and that that is not acceptable, and there will be very significant consequences for people right here in Kansas if Medicaid is cut. I'm not going to go on any longer because I want to give you all an opportunity to share what it is that you are concerned with. We are, again, live streaming this, and it's also going to be available to policymakers at a later date. It's recorded, and we're going to compile the comments that are made at this meeting and share it with the congressional delegation. So with that, we have a list of people who, before the meeting, had signed up online to speak. And I think that we will just go ahead and get started with that list. I don't know that everyone is here, so it could be that we have a little bit of wiggle room. But we're going to start with the guidance of trying to keep comments to about 5 minutes so that we make sure there's enough time for everyone in our hour. So the first person on the list is Lisa Collette. Are you here, Lisa?
Yeah.
Thank you.
Good evening. My name is Lisa Collette. I will try to not get too political, so I'll try to keep it to a minimum and only just keep it to why I'm concerned about Medicaid cuts. So, good evening. I am the mother of a child with a medically complex syndrome, CHARGE syndrome, and I strongly oppose the proposed $880 billion in cuts to Medicaid in the House budget. I strongly oppose these cuts because they affect the most vulnerable in our society, the elderly, low-income children, and those with disabilities. This line item affects my family personally because my daughter qualifies for Medicaid and the services it provides her due to her being born with this rare syndrome, Chart syndrome. Not only is her syndrome the leading syndrome for deaf blindness, she is also nonverbal. Medicaid allows her to have a home health care nurse that goes to school with her and makes sure she's safe medically and to ensure she receives her food because she's tube fed. Having a nurse allows her father and I both to work outside the home and spend one-on-one time with I said almost, he is 17-year-old son. We do things as a family, but because our lives have been spent in and out of hospitals, we try to make sure we recognize his interests and accomplishments. When our daughter needs to stay home from school because she's feeling under the weather, it's nice knowing that her nurse will be there so her dad and I can still go to work and not have to use up all of our leave. As a taxpayer, it's frustrating to see that programs that benefit the most vulnerable are always number one on the chopping block in government when cuts are being made. I've never understood this, and frankly, it doesn't make sense. All it does is add extra stress and anxiety to families and individuals who utilize these life-saving programs. It also puts extra stress on the states because they must figure out how to cover the difference which means cutting from programs that benefit that state. Making cuts to Medicaid also influences school-based services. For example, my daughter has an occupational therapist, physical therapist, O&M therapist, teacher of students with visual impairment, speech-language pathologist, adaptive PE, and nursing services. All these things get reimbursed to the schools by Medicaid. By allowing these drastic cuts to Medicaid, it puts a huge burden on the states and families. It also puts a burden on students with disabilities and their rights under IDEA to a fair and appropriate public education under the least restrictive environment. With the current dismantling of the Department of Education and the thought process of giving it back to the states, it seems obvious that little attention was spent on this part when proposing these drastic cuts. Without Medicaid dollars, local school districts are forced to make difficult choices, decrease the dollars spent on general education students, and increase local property taxes. This leads to added stress for everyone. Again, I will say, as a taxpayer, I've never understood how the government can impose cuts to programs that we pay into every time we get paid. Before I even see my take home, I know that part of my taxes is going towards Medicaid, Medicare, and Social Security, and it feels like the government is double dipping on their citizens when they turn around and make cuts to programs they pay into. I'm not going to go any further because my husband said maybe I shouldn't, but I know I'm in good company here because I did bring up Doge a little bit and raising the ceiling debt, which doesn't make sense when you're paying off a deficit. Whatever. But anyways, I just want to say thank you for taking the time to listen to one of your constituents. And please remember that not every vote on a bill must be because it's how your party is voting. Thank you.
Okay, the next person we have on our list is Julie, and I apologize, Avard?
Avard.
Avard. Thank you, Julie.
Hello. I want to ask everyone, including the people who are watching this later, who has taken care of a loved one who has dementia or who is aging? Okay, so anyone who's watching later, just humor me and raise your hand if you haven't, or think about the fact that, or if you have, or think about the fact if you haven't, try and picture what I'm talking about. So I'm a caregiver for my 91-year-old dad, and for a while, some years ago, we had him at our home, and he was a little more mobile then, and he, but when someone has any type of dementia is a big umbrella for different types of mental incapacities. They have a hard time perceiving what is real, what is safe. They kind of lose their sense of logic, not just their memory and their physical ability. So, and then as you go, as they go on and they age, they do lose more faculties. So it gets harder and harder to take care of or keep the person safe Especially in a house like ours, which had lots of stairs that my dad wanted to go up and down. So after some years, after saving up, we finally were able to get him into the facility. And then when he got worse, the price of the facility that we were paying ourselves got higher and higher. And so we finally moved him to a smaller facility that accepted Medicaid and got him on Medicaid. Without Medicaid, we would have to be helping with his budget that he has would pay for half of what the average price is. You would be paying at least $7,000 a month for an assisted living place. And then when you get into nursing home places, it goes higher. And so my husband and I would have to be paid a couple of $1,000s of our own money, which would ruin us, or we would be just leaving our own lives, completely by the wayside, because someone would have to be with him all the time, because he can try and do something that would be dangerous for him at any given moment. So without Medicaid, we would be up the proverbial creek without a paddle. And there are many lower income people who would rely mostly or all on Medicaid to have a loved one there, or else they would be giving up their entire life, basically, to take care of that person at home. The person, if they are mobile, they could get up and get into anything dangerous or otherwise. They lose their ability to help themselves go to the bathroom. So can you imagine helping your elderly loved ones to the bathroom, every step involved in the bathroom or with showering, and providing meals, and trying to quell them when they wake up in the middle of the night, confused, not understanding what's going on, where they are. So, yeah, without Medicaid assisting with that, we would be lost. And, hold on a second. I have some other statistics here. The Kansas legislators in the past have opposed expanding Medicaid, and they're talking about money, but what everyone is avoiding the subject of is that the state of Kansas would actually be paid money, and we are losing billions of dollars over the last few years because we haven't gotten the federal Medicaid money. I have a statistic here. Louisiana expanded Medicaid in 2016. They received $1.85 billion in 2017, created 19,000 jobs in healthcare, and $185 million in tax revenue. It also increased the federal contributions to other federal programs like CHIP by 20 extra cents per dollar. And before Louisiana did that, they lost out on $11 billion in federal money. They have about 50% more population and a higher percentage of poor people, but the effect would be similar. So all of those legislators who are voting against expanding Medicaid are actually failing to bring in money to the state. They're complaining about not having enough money in the near few years. Recently read an article about that. Well, here's your money. This is what you should be voting for. It will bring the state money, and it will help people who are unable to take care of themselves.
Thank you. Okay, I'm not sure if the next person on the list is here, but I'm going to go ahead and read off your name just in case. Shelley Jordan Howell? No? All right. The next person is Eleanor Cowell. our wires crossed. And so we are going to go on to the next person, who is Elvira Johnson.
I worked as a social worker in a nursing home for most of my career, and over half the residents ran out of funds quickly after they were admitted. Some were already receiving Medicaid when they entered. Most of these people had worked hard all their lives and never thought they would need Medicaid. It could well have been you or your parent or spouse. Nursing home care can quickly run a person out of funds. Even in-home care is quite expensive, and folks who need special equipment such as a mechanical lift and 2 attendants at a time for transfers cannot very well live at home. At this time, my husband and I live on our Social Security, and that works for us right now. We are close to 80 years old and cannot afford long-term care insurance. We have aches and pains and some memory loss, and I am very hard of hearing. I have to shake out my hip and move very carefully when I first get out of a chair. We may well need nursing home care at some point. Our house is not handicapped accessible, and most of our peers have already moved to a retirement facility. We have a woman in our church who receives Medicaid through the PACE program. This is not a time to recklessly cut funding to Medicaid. All people should have access to good medical care. It should be a given. Jesus helped people who needed help. He did not stop to consider whether they were deserving or not. He was a healer.
Okay, oops, I'm sorry. Okay, the next person is Rebecca Schultz. Rebecca?
I didn't really have anything prepared, but I can talk.
Okay. What is the best way that I can help you here?
Well,
I think what I could do, possibly, is, hold on. I need to let you
wait. I know what I can do. I have an elevator on my chair. What am I thinking? I can get behind here.
Oh, okay, good. Okay, perfect.
I'm not used to using it like this.
Awesome.
Good evening, everybody. As you can tell, I'm disabled. I identify as disabled AF, if you know what that all stands for. But that's me. Can you hear me okay, or do I need to roll forward a little bit more?
I think we can hear you.
Okay.
Yeah.
I'm a human being, just like everybody else in this country, in our state. I just kind of look at, I'm a retired special education teacher. I'm a volunteer for NEA on the Disability Rights and Inclusion cadre. I do a lot of volunteer work. I filled out the paperwork for my students who needed the different supports throughout life. As you can tell, this life is kind of expensive. My chair is $25,000 so I can come out and do things. I'm not on Medicaid. I'm fortunate. I've had a lot of supports in my life. I'm thankful for that. But for the people that need it, let's be human beings. Let's be like the Pope who just passed.
Thank you so much.
I don't go this way or I'll drag the cord with me.
I know, I'm sorry about that. That's why we put the sign over here so that we wouldn't trip anyone.
I know how to drive. Thank you.
Thank you. call Kathy Keck next.
Oh, good job. You want to hold it in front of you? Like this? Good job, Jacob. Good evening. My name is Kathy Keck, and this is my son Jacob. And he is holding a picture of himself and his baby sister. So I'm a mom of 5 kids. 3 have significant disabilities. And I wasn't really prepared. I have nothing written tonight, so this is really scary. Plus you said 5 minutes, which is like, whoa, 5 minutes? That's a long time for Kathy Keck to get a microphone. So first of all, I will say, and I say this over and over in any testimony I give, that the issue of Medicaid cuts is not a right or a left. It's a human right. It's my son's right. Turn it around. It's my daughter's right. So for anybody that wants to politicize this, don't talk to me, because I don't want to talk to you about it, because that's why we're in this trouble we're in today. No, Jacob said no. Did you hear that? So that's the first thing I want to say, that this is not right or left. This is truly a human rights. And so I want to talk about what Medicaid means. So Jacob is always eager to come with me. He was out the door this afternoon. As soon as I asked him, he was gung-ho, let's go. He usually testifies when we go to the Capitol to talk about these kind of issues. And so I know I have his permission to share his story. So I adopted Jacob when he was 10 years old. Jacob has a brain injury from a traumatic birth, which has caused his cerebral palsy and his other disabilities. But for 1 minute, don't think that Jacob doesn't understand exactly what I'm saying tonight. So what Medicaid means to Jacob is Medicaid meant to Jacob when he was 10 years old and he moved into my home as a foster, that he was able to get supports in a foster home to support his needs, to live his best life. And I guarantee you Jacob is living his best life. Jacob, because of Medicaid funds, is able to go to a day service program where he does activities that he enjoys with friends and peers that he enjoys. And he's also able to still live at home with the people that know him best to help take care of him. We hire in-home supports to come help take care of him. And so he's able to live his best life. Jacob has participated in other advocacy efforts to help raise awareness about other things. He's been to Washington, D.C., and had a documentary done about him and oral health and the importance of oral health. So Jacob is definitely living his best life because of Medicaid and because of the ability to be able to support him, to not live in an institution. Where when I took in Jacob in my home as a single mom when he was 10, everybody was real quick to run us through that adoption process because nobody thought Jacob would get adopted because of his needs. But here we are, and he's living his best life because we do get supports. Because as a single mom, I couldn't have taken Jacob if I couldn't work. I needed to be able to work. My husband and I, we need to be able to work to support our family, to pay taxes. Without Medicaid, we're not able to do that, to support Jacob. And here, Jake, will you turn it a little bit more so they can see your baby sister? Let's turn it. So that's Jacob's baby sister, Maria. Maria was also adopted. Maria was injured when she was 7 weeks old from being shaken. It wasn't the intent of that baby girl's life. She wasn't meant to have a disability that ended her life the way it did. But Maria, when she came to us, we had no idea what that was going to mean either. But Maria ended up being on Medicaid. Maria ended up needing 24-hour nursing service. So without Medicaid, we would not have been able to keep Maria living in a home where she was loved and she knew love and she knew great joy. Otherwise, without Medicaid services, she would have lived in a hospital, probably indefinitely, in a PICU or an ICU because of the great needs that she did have medically. So without Medicaid, those services wouldn't have been possible. Maria passed away last January, and she died in her home with hospice care. Those things would not have been possible without Medicaid. And I tell you, I know this young lady over here talked about how expensive things are. And I'm going to tell you, things for people with disabilities aren't cheap. We're paying a lot of taxes on services we need and on things we need. And so it's not like we're totally freeloading. We give back. We are buying things. We are part of society. We're out eating. We're out shopping. But without these services, people like my son Jacob with more complex needs are in higher cost institutional settings, which we are moving away from. And so I think just literally what Medicaid means to me and my family is literally life and death, because I've had many people tell us that Jacob probably, he might not be here today without the care he gets, without somebody that knows him 24/7, that knows all his little quirks, knows when he's sick, knows what every thing going on with him might mean. We have very consistent staff for him, people that we're able to train. And so I think Medicaid is invaluable to the lives of people. And thinking of cuts, I've been told, I hear from both sides, because like I said, I am very much, it doesn't matter if you're red or blue. If you go messing with my babies, Mama Bear's coming after you. And so I think that, it's just important to know that we have to work together, both sides of the aisle, to make sure, yes, get rid of fraud, get rid of the blatant fraud. If somebody's 150, yes, close their case down. But if people are truly using the supports, that's not fraud. That's called helping people to live their best life in the most respectful and dignified way possible. So that we cannot cut. You can see Jacob's tapping his baby sister. He might miss her. But anyway, so thank you for just being mindful. As somebody else said, you don't have to vote your line. Just pay attention to the human rights, and it's a slippery slope. Yes, we want to get rid of fraud, but we don't want to do it at the expense of people like my son, my daughter, and my other son at home. So that's all. Thanks.
Oh, yeah, please.
Jacob, do you have anything to say about what's going on? Got anything? I'll hold it. What do you guys say? I'll hold it. Okay, thank you. What do you have anything to say? Okay, well, a lot of times when Jacob gets the mic and we're in settings like this, his one word is poop.
So we have, I think, gone through the list of people who ahead of time had signed up to speak. And now we're going to open up the mic for people who are here and would like to share their reasons for concern about Medicaid cuts and maybe didn't have a chance to sign up ahead of time. So, Christina, did you want to? Yeah. If you wouldn't just mind introducing yourself. Sure. Yeah.
Hi, I'm Christina Keller, and I'm with the American Cancer Society Cancer Action Network. Raise your hand if you've been impacted by cancer, either yourself or someone you love. Almost everybody. Unfortunately, cancer seems to be a pretty universal experience. Medicaid is essential in the fight against cancer. It provides access to life-saving care for people fighting cancer, especially low-income individuals, primarily in rural and underserved communities. Cancer is the second highest cause of death in the United States, and more than 2 million people will be diagnosed with cancer this year. Medicaid covers cancer screenings, diagnostic tests, treatments, surgeries, prescription medications, and follow-up care that give cancer patients the best chance after a life-changing diagnosis. I'm going to share just a few statistics that I think really illustrate the importance of Medicaid to cancer patients and survivors. 1 in 10 people with a history of cancer rely on Medicaid for their health care coverage. States that expanded Medicaid saw more than 2,500 earlier cancer diagnoses and prevented more than 1,600 deaths from cancer in the first 5 years of expansion. And approximately 1 in 3 children diagnosed with cancer were found to be enrolled in Medicaid at the time of their diagnosis. Medicaid is essential in supporting access to health insurance for individuals who would otherwise have no coverage options, ultimately improving health outcomes and reducing the burden of cancer on loved ones and healthcare systems. protecting cancer patients means protecting Medicaid. Thanks.
Fantastic. Okay, I think Heather is going to come up next.
Good evening, I'm Heather Brom. I'm the Senior Policy Advisor with Kansas Action for Children. And one of the many things I do with KAC is I advocate for Medicaid. For kids, for our lowest income parents, and for pregnant women. You've heard a lot about seniors on Medicaid and medically complex kids on Medicaid. But also kids under the age of 18, pregnant women, and our lowest income parents making under $12,000 a year are also on Medicaid. And the cuts will threaten their care. While kids and pregnant women are mandated by Congress to be covered, if we start to see cuts happen, that will impact the providers that serve these populations. Their fees will be cut, which means they will take even less Medicaid patients than they already do. We already have a crisis in the number of providers taking Medicaid patients. We see their rates go down, they're going to take even less. So where are they supposed to get their care? In our rural areas, where people are already having to drive, tens, maybe even hundreds miles to get care. If the providers start to disappear that take Medicaid patients, where are they supposed to go in our rural areas? Healthcare for kids in particular is time sensitive. It helps them achieve in life. It helps them grow. It helps them remain healthy. How many of you remember taking your kids to dozens of doctor's appointments, getting all those well checks to make sure they were, growing on time and meeting all the different recommendations? And if they didn't, they were referred to specialists and to people that could work with them to help them achieve their best lives, whatever that looked like. These cuts at the federal level that they are talking about threaten the health of kids in our state. They threaten healthy pregnancies occurring, and then in that first year of life, which is so important for a baby's health, all of this is going to threaten our kids. But I want to end with our lowest income parents. This is about the federal cuts to Medicaid. This is not about Medicaid expansion necessarily. But we've been pushing for Medicaid expansion because we have so many parents who are in that, I can't believe I blanked on this. Thank you, April. All the things to blank on tonight, the coverage gap, I know this. But, so many parents are in that coverage gap already. And so we talk a lot about fixing that coverage gap will make every kid, making sure that their parents are getting to mental health visits, to doctor's appointments, because a healthy parent means they're taking their kid to the doctor and they're going to be healthy. It's a symbiotic relationship. But if these cuts happen and we don't even get to expansion, it threatens the health care of our lowest of low-income parents, again, making under $12,000 a year. So these federal cuts, I've read all the political chatter, I've read all the conversations, but I think, I heard someone say this earlier and I forgot your name already, I apologize, but all people should have access to medical care, period. And that means our kids, our pregnant women, their parents, people living with disabilities, seniors, no matter what your life experience is, everyone should have access to medical care and be able to afford it, and that is what Medicaid does for our state. Thank you.
Okay, would you like to speak? Come on up.
I'm not on the list for anything, but my name is Kevin, and I am a survivor of a brain injury, and then now I'm actually a provider to Medicaid individuals. Been doing this for many years. My accident was 26 years ago. It changed my life, but I concentrated on making a positive change towards what was important to me, and that was helping individuals who had less and basically the same Medicaid services that we today we're just like, oh my gosh, things are pretty decent for most, and the scary part of what I've been hearing is just unfoundable. It's just unfathomable, I can't say the word, brain injury. But my concern is the people who make the decisions, if it affects them, they're gonna get it done. But the people that I work with are, they have less than, it's like, the Medicaid services that they get are just, I work with people to become more independent before they achieve their goals, set new goals, and I work for Minds Matter. I have many, many years. They gave me provided me services for 2 years, and then I transitioned off and been working, with them the last 18 years. But basically, the cuts that would happen could possibly, cause these people just anguish. It would be unbelievable for them. But I see so much interaction with, I'm a cognitive therapist now, but where when they make these transitions into being able to do the things that they need to do to be independent, it's just like, wow, they just get so excited about it. And for them to be able to, sometimes get into a volunteering situation or, better themselves to get off of services, that doesn't happen often because it's the way it's not set up for them. With people that make SSI, it's very difficult for them to do decently in society for as expensive as it is to live. But, Medicaid services would be, if they're cutting as much as they say they're going to do, it's going to make a huge difference in how we're able to take care of our underprivileged people, especially brain injured people that I've dealt with. I know there's so many different areas that we work with Medicaid services, but that's all.
Thank you so much. Oh, okay. You're ready now? Okay.
But I know that if I need a nursing home someday, I will have to have Medicaid for it to be paid for. So that's scary. I lost my 2 parents to cancer and my grandmother, so it's in our family, so that's another concern. But what I'm most worried about right now are the seniors that are already in nursing homes. What's going to happen to them? They'll be out on the street, And I ask our Congress people, are you going to put grandma out on the street? I'm going to get a little more political here, and I'm going to say that robbing the poor to give to the rich is terrible policy. In fact, I think it's inhuman.
Okay, thank you. Is there any, yes, would you like to?
Hi, my name is Candace Young, and I am a parent of someone with a serious emotional disability, also known as mental illness, also known as all kinds of different very difficult conditions. And I'd just like to plug in that and remind especially our people making decisions that mental health care is health care, and we're connected. And if you pick up any book written in the last 20 years about psychology, you will fast be learning about neurology, neurobiology, neurochemistry, and how connected the whole body is to our mental capacities. And so please, when you're considering cuts, also don't parse us out into pieces and say, well, this is less important. This is life and death, and people will die. Thank you.
Thank you. I'm so glad that you brought that up. Would anyone else like to share something?
I have one more thing.
Oh yeah, do you want to come back? we allow twice. Double dip.
Hey, it's me again, Lisa Collette. One thing I was thinking about that's also really important when we're wanting to make huge cuts to Medicaid is that when you have children like my daughter, not all private insurance is going to pay for intervention services. Some will pay for several sessions a year, or not at all. You have some private insurances who have a different idea of what practical nursing is than what somebody who is living in it and who needs a home health care nurse. So my primary insurance does not cover home health care. My husband's does, which is her secondary. We're fortunate that she has 3 insurances because I work for the Kansas Department of Insurance, and I have people who tell me what I should do when my daughter was born. So I got lucky, but not everybody gets lucky like I did. But he only covers like 200 hours or 200 visits. Medicaid is where it comes in and it covers the rest of that for our children or for our parents who need things. And so I just want you to remember that private insurance does not cover all these things. Medicaid is the one that comes in. My daughter has a medical stroller, $6,000. Medicaid paid for it because private insurance would not cover it because it goes past your durable medical, amount that you get. And another thing to think about, Medicaid really affects early childhood education because we have 29 Part C programs in our state, and most of them only do Medicaid because they don't get, what they get back from private insurance is nothing. And so they don't want to deal with it. It's not even worth to have like an administrator to even do the private insurance because it costs more to do that, to even have somebody hired to do that. So I just want you to remember that it affects your Part C programs where the very beginning of, the early childhood, like the birth to 3, when they're learning, like my daughter went to TARC because there was obvious reasons why she needed it because she didn't walk till she was 2.5 because she has a non-working vestibular system. It's part of her syndrome. People like TARC and all your Part C programs are there to help these children to better themselves and to get to where she is now. She's 11, she's in middle school. Serious, crazy transition period that happened that was nerve-wracking, but we made it. But I just want you guys to remember that private insurance does not cover everything. That's where Medicaid comes in. And so when you cut that, you basically leave people with nothing. Thank you.
Awesome. Oh, okay. I decided these are encore performances.
I already had one comment to make, but I actually want to first build on what you just said. Without getting too far down the weeds of Medicaid, for kids, there's something called Early Periodic Screening, Diagnostic and Treatment, EPSDT, benefit. That means kids get whatever they need that is deemed medically necessary. It is a key benefit of Medicaid that leads to the services that you just talked about. That covers all kinds of things that private insurance would never cover. You don't have quotas for the number of appointments you get if it's deemed medically necessary to treat, to keep you making forward progress. It's going to be granted by Medicaid, or it is at least supposed to be. I know there's some issues there. But I wanted to talk about that. But the other thing I wanted to bring up, that what the cuts could mean, is the impact on our state. We've talked a lot about healthcare in general and in all the ways that it could impact healthcare in our state. But if there are federal financial cuts to Medicaid that, like the match rate the state gets, that the state dollars go down, the state's still going to be mandated to cover Medicaid. They're going to have to come up with those dollars somewhere. They may have to do that through raising taxes. They may have to do that through cutting K-12 education, which is a big part of our state's budget. They may have to do that through transportation cuts, all kinds of other things that you can think about that go on with our state government. It could lead to counties who support their local hospitals having to come up with more money at the local level to keep those hospitals and providers open. And so while we talked a lot about healthcare tonight, I felt like it was really important to bring up one of the other fallouts of potential cuts will be the impact on our entire state's budget, everything else other than healthcare. So thank you.
Fantastic. Would anyone else like to speak? right. I just want to, oh, yes, please come up.
I hadn't planned on speaking, but I just broke my wrist out in western Kansas a few weeks ago. And out there isn't a lot of doctors. The person that set my arm came from Denver, is a physician's assistant. Most of their health care comes from other places. People travel from Salina to give health care, or not Salina, but Hayes. If somebody has a heart attack, they used to life flight them to Denver. They don't do that anymore, I don't think. But it's, there's a lot of people that go to, come in from different places and provide health care for just about anything they want to do. And cutting anything, just having a hospital there is hard to do. But I guess that's all I have to say.
I think that's a really good point. When we see fewer ways to pay for care and more uncompensated care, we can lose hospitals. And in rural areas that are already having to get providers from a long way away, that makes it an even more difficult situation and sometimes even longer to travel to get that care. Would you like to say something? Oh, yeah, please do.
Hi, my name is Rebecca. I also did not plan to speak. I'm a nurse, and hopefully I'm not wearing anything that really identifies where I work, because I'm here as a private individual. Just kind of take me as generic nurse. I don't have so much a statement as a question, and that is a question for the people who are thinking about cutting Medicaid. And that's, what do you want us to do? What do you want us to do in healthcare? You know, are we supposed to take someone in the middle of a cancer treatment plan on Medicare and say, well, you're done now, go home? You know, if we're a long-term care nurse and our patients' Medicaids are done, are we just supposed to evict them? If, you know, we're a home care nurse taking care of a disabled child, and maybe Medicare is still going to have to provide for them, but the structure of it changes such that they're no longer going to get home care, they're going to have to go to an institution. Do we just say goodbye to our patients and say goodbye to their health care? My challenge would be to any lawmaker that wants to cut Medicaid, I want you and your staff to commit to coming to work with some of us when we have to kick those people out, when we have to tell them no. I want you to be the ones to tell someone, you have diabetes, but your treatment plan is done now. Good luck. I don't think it's fair that we in healthcare are going to have to be the ones to bear that emotional burden that you're creating for us. Thanks.
Yes. Okay, another encore. Come on.
Yes. Okay, well, I just had to come back because I often testify and Jacob comes with me. And I know that that brings certain perceptions because Jacob is who a lot of people would consider very complexly disabled, right? But I stand in front of you, and if I just came by myself as Kathy Keck, you would just think, hey, I'm this great advocate, I work, I do this, I do that. But the reality is in 2018, if things would have turned a little different, if I wouldn't have been married, if I would have still been single, I would have become a Medicaid recipient when I got diagnosed with stage 3 breast cancer. And so I think all of you that are voting on Medicaid cuts need to look around the room, because each and every one of us are one diagnosis, one accident away from needing this very same service, unless you, of course, are the really high of the elite, which most of us Americans are not. And so I think we just need to consider that it is one accident, one diagnosis. I didn't wake up in January of 2018 thinking I was going to have breast cancer and need all sorts of treatment, and every day knowing that, hey, it could come back, right? And so I think we forget that sometimes, and we can dismiss people like my kids, like, oh, well, they're the extreme. That's not everyday people. But really, Medicaid can affect all of us. But by the grace of God go I. That's what I like to say about that. So.
Oh, fantastic. Okay. I am just going to be silent for a very short time and give people the chance. If you would like to speak, you're more than welcome to. I think that we've had such, yes, I think we've had such a fantastic representation of different concerns that people have. I'm so grateful for your courage to come and speak at this meeting. If there's anybody who did not feel comfortable speaking in front of the room, but you do feel comfortable sharing your concerns, we have note cards in the back, just index cards. If you write your concerns on those cards, we'll make sure that they get added to the record of this meeting and get passed along to those members of Congress that represent us. So with that, I want to again thank you. I want to encourage you, if you haven't already signed the petition, to do that. And please let us know if we can do anything to help you in your advocacy on the, trying to prevent these cuts to Medicaid. Thanks, everyone. Yeah.